Hi, I'm Stacy Terrell Dennis, and I have hepatitis C. Hepatitis C, however, is not who I am. I'm a mom. I'm a grandmother. I'm an author. But hepatitis C has drastically changed my life, as it has millions of other people. I wanted to share with you some information about hepatitis C. It's transmitted via blood-to-blood contact. It is contagious, it is viral, and it affects the liver. An estimated 150 million people worldwide have hepatitis C, including 3 to 4 million Americans. According to the World Health Organization, about 20% of the people that are infected will develop cirrhosis of the liver, which can result in death. For many years, hepatitis C was treated with interferon. Interferon is a really, really harsh drug. It's similar to the type of drugs that people take for cancer. It has very harsh side effects. And most of the people that start interferon treatment, or a good portion of people that do the interferon treatment, usually end up not being able to complete the process. The reason for this, of course, are because of the side effects. In addition to that, only 50%, that's 50% of the people that are treated with interferon actually will have success and clear the virus from their bloodstream. In order for you to be cured from hepatitis C, the virus has to be totally cured from your system, or totally cleared from your system. Your viral load, or the amount of virus that you have in your system, can't just be lowered. It has to totally be cleared. Now, I was, in 2010, given the medication, which I have here. That's my interferon. And it was, or it is dated 2010, September 9th. 2010. Obviously, I didn't take it. I chickened out because of the side effects. Some other interesting information: people with hepatitis C will die 15 years earlier and have a 12 times greater risk of death compared to those without hepatitis C. Viral hepatitis kills more Europeans than HIV. The European Union citizens die as a result of viral hepatitis C at a rate of about 10 times greater than deaths related to HIV. Now, there's a lot of talk right now about baby boomers. Baby boomers are people that are born between 1945 and 1965. Of course, I'm in that group. I'm not going to tell you how old I am, but I'm in that group. But those people in that group have a greater chance of having hepatitis C. And for that reason, we need to be tested. You need to go out. If you're a baby boomer and you haven't been tested, you need to go out and get a test. Now, the reason for this is because of a lot of goings on, as they say, of the things that were going on in the 60s and the 70s, and some of the partying and things that a lot of us were doing. Now, I thought this was interesting, reading this article about baby boomers need to be tested. One lady's comment says, So just because some people lead a not too sanitary lifestyle in the 60s and 70s, that would be me, by the way, the unsanitary lifestyle, all boomers have to take this test. Ridiculous, she puts. Well, ma'am, I'm sorry to tell you that it's not so ridiculous, because during the 60s and the 70s, blood was not tested. So if you had a blood transfusion during that time, you have a greater chance of having hepatitis C or even HIV. The utensils or the items that were used by nail salons and ear piercings, and I don't have a tattoo to show you, but by tattoo parlors, there were no standards. So if, I won't mention her name, she did put her name, but if Miss Ridiculous, you had your nails done, then you have a greater chance of having Hep C, as much as the rest of us that were doing the unsanitary things in the 60s and the 70s. So it's not just about those people that were partying and went to the parties where they passed the little mirror with the little lines of Coke with the $100 bill, which is one way that you could have contracted Hep C. But the other ways that are totally normal are going to the doctor, because it was not also mandatory that physicians change their gloves per every patient. So if you went to the doctor in the 60s and the 70s, you have a greater chance of having hepatitis C. If you went to the hospital, if you had blood, if you went to the nail salon, if you went to the tattoo parlor, if you had your ears pierced, or any of those things, as baby boomers, we have a greater chance of having hepatitis C. So you really need to go out and get yourself screened. I implore you to please to do this. Implore you to do it. So one of the other things I want to talk about are some of the newer cures. This Friday, the FDA is going to approve a drug that will not have the side effects or any of the problems of interferon, and it will be a pill, which I failed to mention that this interferon, this is an injection. Okay, so this is an injection pen. The new drug is a pill form. You take a pill. You don't have the horrible side effects. It's not like taking the cancer drugs, the chemo, which was I was trying to think of a few minutes ago. Chemotherapy, that's what I was trying to come up with in my mind, and I couldn't. But it's not like the chemo drugs. It's not like interferon. The side effects are minimal. Headaches, nausea, and some fatigue. Those are the main side effects for the new pill that will be approved by the FDA. This pill is from Gilead, and in addition to that, there's also a pill by Gilead that, when taken with a pill that was produced by Janssen, that has a 94% cure rate. Now remember, interferon has a 50% cure rate. So if you take Gilead and Janssen's pills together, you have a 94% rate. Now, the pill that comes out on Friday is a combination of those two types of drugs together, so that you don't actually have to cross over and do two different drugs by two different manufacturers, because for money reasons, obviously the two manufacturers of those drugs would not work together in order to give us a cure for Hep C. Although we have all of these millions of people worldwide, of course it's all about the money. Speaking of which, the new pill that comes out on Friday will probably have a cost of somewhere around $110,000 for the entire, I think, 12-week course that is required to take, that you're required to take in order to clear the virus from your bloodstream. So, for $110,000, if you have that kind of money, you can get the cure for Hep C. Or if your insurance company will actually approve a payment of $110,000, which is the other problem. Most of the insurance companies are saying that if they were to approve payments for all of the people that are actually infected, they would go bankrupt. So the United States is one of the only countries, the greatest country in the world, that has no caps, or they don't have any restrictions for the drug companies of what or how much they can charge for drugs that actually cure diseases like Hep C. Now, interestingly enough, in Europe, they've already been approved by their comparable, whatever their FDA is, and their people are actually getting the cure now. Their government is making sure that their people are getting the cure. Canada, their people are getting the cure. Japan, their people are getting the cure. But in the United States of America, we can't get the cure because we can't afford it. Now, if you happen to be one of the lucky ones that your insurance company does approve for you to get the cure, your copay could be as much as $10,000. Let me repeat. Your copay could be as much as $10,000. So, if you're rich and you have $110,000, then you can just run out and get the cure. Okay? If you're moderately wealthy and your insurance company actually approves it, then you can get the cure, because you moderately wealthy people may have $10,000 lying around that they can pay for the copay. But if you're the rest of the normal people out here, then it may take another 10 years for the cost of the Hep C drug to drop enough for you to get the cure. And if you live in other countries like Africa, places like that, the chances of you getting a cure are even less. This is a sad state of affairs for all of us. And I'm speechless, which is a rarity, as to what to say about the dilemma of how the rest of the people in the United States of America are going to go about getting the cure. How many Americans will die while waiting for the hepatitis C cure?